In this time of COVID, some people are putting off medical treatment. In tonight's Health News to Use, doctors warn that waiting to seek help could put your health at risk, especially if it's your heart.
Patients are concerned that their chest pain just might represent COVID, so they might want to put it off for a couple days. Maybe wanted to see if they develop a fever or cough, when in reality, that chest pain is actually, heart attack.
Dr. Mark Blubaugh, medical director at Tulsa ER and Hospital, warns a heart attack is serious. Minutes count when blood flow is shut off to the heart.
The sooner you can get that artery opened back up by a cardiologist, like with a stent or with angioplasty, the better the survivability of that heart muscle is. The less, heart damage is done, and therefore the less long-term effects that you'll have.
While chest pain or tightness is a common symptom, patients may also feel short of breath, nausea, diarrhea, cold sweat, or fatigue. Women may be different.
They have other symptoms like maybe just generalized fatigue or nauseous, or maybe an upset stomach. Diabetics are another group that don't have the typical presenting symptoms as well.
Here's something else patients mention in the ER.
A lot of the time people come in, they complain of jaw pain or tooth pain, and they think they might be having, a tooth abscess or a tooth infection. Well, if they're a high-risk candidate, one of the things that should be screened at is always for a heart attack.
Coronavirus poses yet another risk. It can cause blood clots, leading to stroke or heart attack, even in patients who've never been at risk for heart disease.
Even if you don't have risk factors, but you've had a recent diagnosis of COVID, and you're having those symptoms of chest pain or shortness of breath, I would definitely recommend getting to the closest emergency room to be evaluated.
Heart disease is the leading cause of death for all Americans, so doctors say we really need to take it seriously. I posted a list of who's at greater risk on our website, kjrh.com.